you Drew?
Yes, I am.
Hi Drew, I'm Jenna. I'm going to be the occupational therapist that's working with you today. So I hear you're in for a rotator cuff injury.
Correct.
Okay. I got the doctor's note here, and it said that you received an MRI, and it has been confirmed that it is a rotator cuff tear. So do you know anything about rotator cuff tears?
No, I do not.
Okay, so that's kind of the point of today, so I'm going to go through that with you. I did create a handout, so if you're okay with it, I think the two of us could just walk down through it.
Sure.
Okay, so there is your handout. I kind of just want to get to know you a little bit first and kind of the situation. So can you tell me what happened that made you come in to the doctor?
Oh, I was at work and I was picking something up and I could feel the pain in my shoulder. It had been going on for a while, but that's when it got really bad when I tried lifting something a little heavy.
Okay, so you've had like pain for a little while now?
Yes.
Okay. Anything else with that? Any weakness or?
I would say weakness now ever since it happened.
Okay. And then what is causing you the most pain? Like when you said that you had been realizing it is it just a constant pain or when you're doing something specific?
It wasn't always constant. It was there.
Okay.
But ever since the initial
Okay.
going to the doctor.
Okay. And when does it hurt the most? Like when you're like moving your arm up and elevating it or anything like that?
Up and elevating it and stuff like that.
Okay. So if you had to kind of pick like a range, what's the most painful? Is there kind of a range that is hurting the most?
Yeah, one of my shoulders.
Right there. Okay. So it's kind of like the 70-120 range. So that's called the painful arc. On a scale of 1 to 10, with 10 being pretty like excruciating, unbearable pain, what do you say is pretty typical for the pain?
I'd say about a 7.
Okay, about a 7. So what I'm hearing from all of this and from what I'm seeing from the doctor's MRI is that you have a supraspinatus partial tear in the superior part of your shoulder. So I'm just going to kind of explain a little bit what that is. Do you have any questions so far?
No.
Okay, so the rotator cuff has basically 4 main muscles in your shoulder. And what they do is they work to stabilize and mobilize your arm. So this joint right here, this is your humerus, and it kind of has a head at the top that connects with your shoulder blade, your scapula. And what's that called? It's called the glenohumeral joint. It's a ball and socket. In a typical shoulder, when you're elevating, the ball of the socket should be rotating superiorly, but at the same time sliding down inferiorly. Because if it just kept rolling, it would kind of roll right out of the socket. With your supraspinatus, or with your supraspinatus, which is right up here, it kind of connects from your shoulder right to the top of that ball. So with it being partially torn from the muscle, which is what a tear is, it's torn partially away from the muscle, so you're having a really hard time with that. And it's not getting that inferior slide. It's doing a superior roll and a superior slide. So that's kind of causing that pain when you're elevating your arm. So that can make it really hard to move your shoulder during elevation.
Is this very common?
So it's more common in older adults. What you have is called, again, a partial tear, meaning just a part of it came off from the bone, the muscle from the bone. There's another type that's called a full thickness tear, and that means the muscle fully has torn away from the bone. There's nothing left connected to the bone. Your partial tear is more common, and especially because you're, what do you do for work?
Construction.
You do construction, okay. So because of that, I'm guessing it's kind of a heavy labor job. Because of that, you're probably getting that progressive degeneration of the muscles already due to like small traumas, and then that trauma, you trying to lift up that heavy pipe, probably just got a little bit further, and that's what made the pain and weakness worse and more noticeable for you to come in. So it is common with this type of job. The symptoms that you noted, that 70 to 120 arc, that's very common for the painful arc, again, with the upward elevation. So that is pretty common.
Okay. How long is it going to take to heal?
So for the healing process, I'm going to start you on a treatment plan, and we're going to just start with 12 weeks. My main goal here is going to be to get you back to doing the things that you want to be doing. From what I can hear, you kind of just want to get back to work and doing the things there, right? Mm-hmm. Okay, so that's going to be my goal, is getting you back to that. But first, we have to assess your pain. All of this treatment is going to go off of your pain scale. So first, we're going to just start with, it's called passive range of motion. So that's kind of letting your arm in your shoulder do the work itself. You're not moving it. It's just kind of like hanging and moving, or someone else moving it for you. And that's going to help stretch out those muscles. When you get an injury, really anywhere, but especially in the shoulder, there's something that happens that's called muscle guarding. And what that is that you've been so used to having pain that your muscles are starting to get tight because they're scared that each time you move, you're going to be causing that pain. So what we want to do is show them that it's, it's okay, we're going to build towards it. So we're going to start stretching them and just getting them loose. And that should help decrease the pain and get some of that functional, mobility back in your arm. How does that sound so far?
Good.
Okay, so once we get that, and once you're back to some of your old activities and get the pain decreased, we're going to move to active range of motion. That's going to be working on strengthening the shoulder girdle muscles, so kind of everything around your shoulder. The tear is not going to heal itself. It's not going to connect itself to the bone. So what we want to do is focus on all the muscles around it, because we're going to want them to kind of compensate for that job, just so that tear doesn't keep increasing, because if everything around it isn't strong enough, you're just going to be continuing to injure it, and it's going to pull further and further. So that's going to be what the goal of active range of motion. So that's going to be more of the free weights and pulling kind of exercises just to get that strength back. So those are going to be kind of the progression of those 12 weeks. I do want to note that during any of this time, if you're feeling pain or inflammation, if it's just kind of sore, feel free to take over-the-counter medications, the Advil or Tylenol, just to kind of help with that. If there is any inflammation on it, or just kind of help with that pain. And I also will mention that before we do exercises, I'm going to put heat on it for about 5 minutes, and then after, ice for 5 to 10 minutes. That'll really kind of help ease those muscles and get everything working properly and help you feel a little bit better. I also want you to do that at home if you're doing any of these exercises at home. These exercises are mostly going to be done 3 to 4 times a day. When we get into the active range of motion, a little bit harder exercises, I'm going to be having you take a break in between those days. So kind of every other, just to give your body time to heal. So how are you feeling so far? Do you have any questions?
No.
Okay, so the next part of this, I'm not only going to work on getting that strength back, but I also want to do some activity modifications, meaning I want to modify your work environment to be able to keep you working. So do you have access to a ladder or a step ladder at work?
Yes.
You do. Okay, so anything that you're lifting up, if you can just get to a height where it's more like of a smaller lift, or just putting it straight in so you're not getting that elevation motion, that will be helpful. Otherwise, if there's any jobs that you can do, just trying to get something at a table or waist level, just so you're not bending down or lifting up or getting that wide range of motion, just kind of keeping everything in front of your body.
Sure.
Especially in the meantime, if you do have to continue working, because we really want to rest that shoulder. We don't want to get that tear to increase before we get to those strengthening exercises.
Is there anything I should or should not do during this time?
Yep, absolutely. So that's a really good question, because we have that increased risk of further tearing. I think that it's important that rest is very utilized. I know it seems simple and easy, but making sure to get enough rest for your shoulder just so it has time to heal, and making sure you're getting enough sleep at night. Sleep is the time where your body just relaxes and heals itself. So that's really important. And then also just, again, not reaching up and not reaching back, using your pain as a measure. If something's hurting, try and get someone else to do it, or if you can just use your non-dominant hand for it. And how's sleeping on that side?
Not good.
It's not good. So then just finding a way, if there is a way for you to sleep on your other side, if that's uncomfortable, maybe just putting a few pillows underneath it to kind of lessen that, or just something kind of a base back there where you won't be rolling on that side, just something to prevent that, so you're a little bit more comfortable and you can get that needed rest. And then avoiding any pushing exercises. Again, that's repetition of what I just said, but just if you go to the gym, try and stick more to like cardio, or things that aren't going to have you be pushing very much against a resistance. How are you feeling?
Good.
Okay, so for these 12 weeks, I think we're going to go through the passive range of motion, active range of motion, activity modification. I do want to note that if we don't see pretty significant gains in pain and functional mobility by that 12-week mark, I do think we're going to need to look into surgery as the next option just to get things reconnected. Because if we don't see those gains within that time period, it typically means that surgery would be the most beneficial option for you. But I just want to let you know that that may be in the future, but I really think that this exercise program should get you where you need to be.
Okay.
Okay, do you have any final questions?
Nope.
Okay, I really appreciate you coming in today, Drew, and I look forward to working with you.
Yes, thank you.
Thank you.